The surgeon marks the specific anatomic landmarks on the palm of the patient's hand with a pen before starting the operation. After anesthetic is injected, a 2 to 3 centimeter incision is made in one of the wrist creases away from the palm. The skin is then retracted and another smaller incision is made slightly deeper, creating a safe, clear pathway into the carpal tunnel. Through this small incision, the surgeon is able to view and protect the median nerve and flexor tendons. A series of instruments will then be inserted into the carpal tunnel. A flat spoon-shaped instrument, called a synovium elevator, is inserted into the tunnel, just deep enough to the transverse carpal ligament to gently separate the tissues from the underside of the ligament to begin creating a path for the scope. Then a series of blunt-shaped probes are inserted into the carpal tunnel to create a pathway for the scope and blade cartridge. The entire system is composed of a trigger-operated handpiece, a blade cartridge, and an endoscope with an integrated fiber optic illumination and video camera. The blade cartridge is checked prior to insertion. The endoscope is then introduced into the carpal tunnel. With use of the endoscope and a TV camera, a clear inside view of the tunnel and transverse carpal ligament is seen by the surgeon and operating team on the video monitor. Here you see the very dense, white collagen fibers that make up the transverse carpal ligament. The entire length of the underside of the ligament is viewed. Once the surgeon sees and reaches the distal or far portion of the ligament in the palm, the trigger is squeezed, elevating the blade under direct view. The device is slowly pulled toward the wrist side of scope entry, precisely cutting the ligament. Approximately 2 to 3 passes are made to completely cut or release the ligament and enlarge the canal to relieve pressure on the nerve. The blade cartridge is then reinserted to inspect the cut ligament and verify that all the fibers have been divided and the tunnel made larger. Here you can see the complete release of the transverse carpal ligament. Volume inside the carpal tunnel has increased dramatically, giving relief of compression on the nerve so that it can recover function and comfort. The wound is closed with stitches and dressed to allow for full finger and thumb use post-operatively.